In this lesson, we'll explore some techniques used by psychodynamic counselors. We'll briefly discuss defense mechanisms, transference, and free association. Psychodynamic in practice. The focus is to bring into awareness the unconscious activity that determines thoughts, feelings, and behavior. This awareness will strengthen the ego, resulting in a reduction in discomfort. Defense mechanisms. Two main paths to defense mechanisms. One, denial or distortion of reality to find a state of calm. Two, these happen unconsciously. Everyone engages defense mechanisms on a daily basis. When they become ingrained, they become problematic. The role of the therapist is to help the client see what they can't see. When the client wants to change the subject, something feels threatened. Anxiety shuts down the difficult emotion. Difficult feelings are triggered from the unconscious. Defense mechanisms help cope with this difficulty. The therapist notices the presence of defense mechanisms that are used to distort or deny reality and brings this to the awareness of the client. Client acknowledgement of what is happening relieves the difficult feelings. Psychodynamic therapy session. The therapist finds out the presenting problem the client brings. The therapist attempts to work out what is the trigger that is causing the anger. Explores the client's life to identify what could be the potential cause or trigger. Identifies when the client's situation may have changed. Has it always been like this? Uses word association to understand what is going on in the unconscious. The therapist interprets the responses from the word association, identifying themes. The word association helps the client see their situation differently, see what they didn't see before. Feelings are acknowledged and named that were denied or distorted previously. A new link is made between the client's feeling and their true reason for feeling the way they do. Transference. Transference is when a person unconscious redirects feelings, desires, or expectations to another, often in therapy. Trying to recreate a past relationship happens in therapy because the client is in a safe space which allows the unconscious to speak. Countertransference is where the therapist reacts out of transference. This can be unhealthy. Transference can be good and bad. Transference should be explored in the therapy session, otherwise the client may be stuck in the past. Transference will indicate when unresolved issues need to be explored. Identifying the cause of transference, for example, behavior or word that the therapist uses, which will identify the unconscious trigger. Free association. Free association is a technique used in psychoanalytic therapy to help clients or patients learn more about what they are thinking and feeling. Freud used free association to help his patients discover unconscious thoughts and feelings that had been repressed or ignored. When his patients became aware of these unconscious thoughts or feelings, they were better able to manage them or change problematic behaviors. The goal of free association is not primarily to uncover hidden memories, but to identify genuine thoughts and feelings about life situations that might be problematic, yet not be self-evident.